Welcome to For the Health of It, our series where we bring together luminaries, thought leaders, and industry experts to talk about some of the biggest challenges in healthcare. With us today is Jamey Edwards, co-founder of Cloudbreak Health. Welcome, Jamey.
Great to be here, Bill. Thanks for having me.
To get us started, why don't you tell everybody a little bit about yourself and what Cloudbreak does?
Sure. Jamey Edwards, co-founder of Cloudbreak Health. I am a entrepreneur who has been mission-driven in the healthcare space since 2008, when I started with my uncle's company, a company called Emergent Medical Associates, as its CEO. It was an ER hospitalist and anesthesia business. Ended up growing that company significantly, and then teaming up with my co-founder at Cloudbreak, Andy Panos, to help build a health disparity solutions business and increase my impact at scale. I think as an entrepreneur, right, that's all you really want to do is have a great idea, make it real, and then have it impact as many people positively as you possibly can. And Cloudbreak has been a wonderful platform for that.
So you guys often talk about humanizing healthcare, which is a common refrain for technology companies. But can you talk about what that actually means to you and how you bring that to life in your business?
Absolutely. And, when we started talking about it at Cloudbreak, it wasn't so common. You read a company's mission statement and it was like, we are in the business of providing compassionate care to patients. Like, at every healthcare mission statement sounded the same to us. And when we really did our work, and, I cut my teeth on the provider side of healthcare, and I saw what provider burnout looks like. And the number one symptom of provider burnout is treating a patient like an object instead of like a person. And that really hit me pretty hard at my core when I saw doctors who are just churning through patient after patient after patient, and realizing that each one of these patients has a unique story. They're a brother, a sister, a mother, a father, a son, right? These are real people. They are not a data point or a statistic. And so our humanizing healthcare mantra came out of that understanding and our desire to make sure that in healthcare, where it's so easy to not treat people appropriately because of all the challenges and the regulations and all these types of things, that we were treating people like people, patients like people, that doctors were being treated the way they should be treated too, that patients were treating them not as a consumable resource, but as a partner in their care. And that's really where it came from. And today, the Cloudbreak platform's in 2,000 plus hospitals across the country. It started off bringing medical interpreters to the point of care for limited English proficient and deaf patients, and has since expanded to resolve other health disparities like shortages in nursing staff and shortages in physician staff, or during COVID, our telequarantine use case, which was all about humanizing healthcare. It was about how do we protect our frontline healthcare workers from catching the infection and all the risk that they were taking every day to treat patients, and how could we take what was a very lonely diagnosis in COVID, and an isolating one for the patient, and make it less so. So we actually beamed family members into the point of care. Our platform allowed any patient room to be turned into a connected care room and solved a huge problem for those hospitals.
So talk about how that works, right? This is a fascinating idea of like having a platform to either minimize disparity, improve the quality of care. How does that actually work in practice?
Yeah, well, in practice, right, when we talk about healthcare disparities, what we really want to guarantee is that patients who are underserved can receive the same standard of care as their English-speaking counterparts or their more wealthy counterparts, and that there's a base level of overall quality in the healthcare system, and that quality is high. And health disparities have to do with not just the quality of care, but also can you access the care, right? So for us, the telemedicine part of our solution was all about increasing access at the point of care. It was bringing into underserved communities specialty providers who that community might not normally have access to, because maybe there's not a neurologist who lives in that community, or there's not a urologist who lives in that community. So what do? You beam them in via telemedicine. But when it came down to our limited English proficient and deaf and hard of hearing patients, resolving that disparity meant you show up to a hospital, you might speak a language. 1 in 5 families in the United States speak a language other than English in their home, right? So their primary language is something different. So when they go to a hospital, they are entitled by regulation to an interpreter, and to be able to communicate in their primary language in order to seek their care. So that was previously done with in-person interpreters, either through full-time staff or an agency, or it was done over the phone. we actually pioneered video medical interpreting, bringing the interpreter in over a telemedicine platform. And interestingly enough, video sits at the crux of a Venn diagram that's cost, quality, and efficiency. Video is right at the center of that because it allows ready access to the resource on the other end of the screen. 70% of communication is nonverbal, so it makes it all the more tangible and more efficient in encounter. And all of a sudden, these patients, like you can imagine, Bill, how scary it must be to be in a hospital when you don't speak the language and be in an emergency department and people putting needles in you and you're not understanding what's going on. And so we saw it as our mission to help people in the scariest time of their lives, improve the overall value of their care, and to be able to take a little bit more control and be empowered in what is normally a very scary environment for them, as well as empowering the doctor to make a better diagnosis, right? Communication is the number one diagnostic tool that a provider has. So what happens when they don't have that communication? Well, they order a lot of unnecessary testing, they practice defensive medicine, and they might not end up with the best outcome. So our focus was on providing this communication platform that really helped level the playing field.
So there's been obviously a lot of conversation about the disparities in healthcare, but I think too often connecting the dots to also the digital divide is important as well. There's a number of initiatives around like bringing broadband to rural areas and the distribution of where people live. Like, how are you guys dealing with that? Like the technology component that can potentially make disparity in care worse, if that's the right framing. Is there things that you're doing, or do you see regulation coming on the horizon from the government? Like, how do we make sure that the technological gap in some parts of the country and with some communities in our country is not making this more of a problem than it already is?
Yeah, Bill, it's great. I mean, what an observant point to bring up, right? The fact that, sometimes the technology, while its aim was to level the playing field, actually creates a bigger divide. And we've seen that firsthand. Broadband access is clearly an issue across the country. The government has set up telemedicine resource centers in pretty much every state. Some of the states have combined so that they're working on those types of broadband connectivity initiatives. I think the advent of 4G and 5G cellular has been very helpful in that as well. But then you start getting into, well, how many people in that community actually have a smartphone, right? And so can they use telemedicine and video and those types of things? But then you take it down to the next level, which is that, we have a device which is pretty ubiquitous called the phone. And the phone, I think people in telemedicine have largely overlooked it, but the phone can be a tool that is, everyone knows how to use it. Most people have one in their home. It doesn't have to be a smartphone, but you can get a doctor on the phone who at least can help you wayfind, to the current issue, can maybe give you a little bit of comfort while you're waiting to be seen in person by somebody else, or maybe can guide you to the right care center from an urgent care standpoint or hospital standpoint, or maybe deploy an ambulance if you need an ambulance deployed, right? So, but when you take a look at the digital health tools that are out there, like a lot of people have talked about this with AI. AI is supposed to be out there being unbiased, but if you feed an AI biased data, you're building a biased AI. So all of these issues are critical. For us, we've tried to make our platform as ubiquitous as possible to solve the issue. It's on PC, iOS, or Android. It's usually provided by the local healthcare system, so there's no real cost to the patient of the platform. And we've tried to just be in as many places as we can, right? I mean, 2,000 plus healthcare venues across the United States is a pretty big network. And what most people don't realize about this digital divide that you're talking about is it's not just rural areas, right? There are medical deserts in some of our nation's biggest cities. I live in Los Angeles, and we have some inner city community hospitals that simply don't have the same resources that some of the more affluent communities have. Not everyone in LA gets to go to Cedars or UCLA, right? Or USC. Some of them go to a local community hospital that might be struggling to make ends meet and doesn't provide the same level / quality of service. And so working to get the platform out into as many places as possible and really do it in a low cost and affordable way has been the main thrust of what we're trying to do. And I think a lot of it also stems from doing other types of community initiatives. Can we help solve, food desert issues in some of these communities? Can we use the platform to do other things like training, on how to use the platform, et cetera, et cetera. So we've tried to be as flexible as we can to help address these disparities, and it's a key part of our mission.
So you mentioned before the platform helping people navigate the health system and potentially, I would assume understanding how to potentially pay for care can be a part of this as well. The way you describe the work that you're doing and the situations that you're addressing, I would imagine that the policy, creators or the payers, the insurance policies would also be interested in this kind of disruptive technology. Have you been working with any of those groups, and what, from your vantage point, has been their perspective on how these kinds of innovations are playing a role in their ability to manage their own population or their own consumer populations of the policies that they subscribe to? That was a very terribly worded question, but hopefully you understand the gist.
I've got it. I get the gist of it. So look, there's many stakeholders in the system. You have the payers, you have the providers, you've got pharma, you've got the patients, right? We refer to them as kind of the 4 Ps of the healthcare system. And right now, not all of them are aligned, and they all have different needs, different missions, different wants. And so our goal has been like, how can we get all of these people on the same side of the table to collaborate, using the platform? And so in the payer market, we haven't done as much there because our focus has really been the hospital and health system market. We've started to get into the payer market now, and the nature of collaboration there could be really interesting, right? So if you're working with someone like Kaiser or Blue Cross or Blue Shield, could we actually bring one of those representatives to the bedside over our platform to help that patient make smart decisions about their care choices, right? Could that payer use the platform to follow up afterwards with our in-home platform so that they can continue to monitor that patient, or so that they can communicate with that patient post-discharge and say, hey, how's that wound? Can we take a look at it on camera? Those are the types of things. There's literally thousands of different use cases for the platform. And it's really just a question of finding people to raise their hand to say, yes, we want to work on those. But for us, the payer market is the next vanguard of where we'd like to go.
One of the things that I've observed is that, especially with the explosion of connected devices, platforms like yourself, like there is no shortage of technology being thrown at this problem.
Right.
But I think oftentimes we forget that not everybody, a large portion of the population, is not that technologically savvy. You look at some of the things that are happening in market, like Best Buy is starting to get into the health space to help, people get the right kinds of smart devices to manage their health, get them all connected, get them set up, sort of like Geek Squad for health. How's your platform helping with some of the integration, interoperability challenges? Like you talked about the phone. That's a fairly, I think, straightforward use case. But are there other instances where you're plugging, smart devices in to get diagnostics remotely, blood pressure cuffs, like things like that? Like, is your platform interoperable like that? And how are you seeing that challenge in the market?
Yeah. So address the first part of your question, Bill, right? Like, the problem in healthcare today has nothing to do with technology. We have all the right technology. People know how to use email and video and their iPhone and their iPad. Grandma, I'm amazed at how intuitive the iPad is and how many grandmas are just sitting there doing their thing, right? On those devices. So all those devices are pretty intuitive at this point, not saying that there doesn't need to be more training and more ease of use, because there does. And we've tried to make our platform as easy to use as possible. It's literally push a button, get the service that you want. There's not a lot of other work that the patient needs to do from that standpoint, but a tech savvy standpoint. But the problems in healthcare today are regulatory, they're process oriented, they are silo driven, the fact that, and they're really payment model driven. And if we could fix those things, we have all the technology that we needed. Like, Bill, during COVID, right? First 6 months, I was completely excited about seeing like the world drop trillions of dollars of GDP to band together as one human race against what was, a cellular organism that we were all battling together. And while that was scary and it was a tragedy that people died and all those things, like, you kind of stood there and you're like, look at the power of what happens when we all pull together under one mission, right? Yeah. And that's currently what doesn't exist in healthcare. There's too many different missions. It's incredibly complex. There's very little transparency in terms of, you had bought up payment models and pricing before, right? Very little transparency in terms of that, which is how companies like GoodRx have popped up to become so successful, because people are realizing they don't need to spend $300 on a prescription. They can spend $30 on that same prescription. Right. But there was very little pricing transparency, and GoodRx brought that to market. So I think when it comes to that, like, we have been really focused on our platform on ease of use. we have pioneered interoperability of bringing our services onto other telemedicine platforms. So bringing language interpreters into American Well, bringing them onto Epic, doing all those different types of things. We've built out all of that interoperability as a core part of what we do as a business, because we realize it's not about us being in the market selling equipment. We want to be on as much different equipment as many different pieces of equipment as we possibly can. One example of that is we have a partnership with OneView, which is a company that does the patient engagement platforms in hospitals. They have the TV on the wall. It has all sorts of different services on it. We've integrated our interpretation services onto that platform, right? So all of a sudden, it allows the service to be more easily accessed, more ubiquitous, all of those different types of things. So interoperability is absolutely key. We've integrated devices into the platform as well. That's a newer part of the business for us. It hasn't been as well developed, but it's definitely there and growing. And we see a huge opportunity for the new age of remote patient monitoring and all these hospital at home initiatives that are being, pushed through by Medicare and Medicaid to actually see that the four walls of the hospital are breaking down. Healthcare is becoming more decentralized. And the more that we can keep a patient in the environment in which they're comfortable, whether that be the office or the home or on the top of a mountain somewhere, if we can get them the care they need on their terms at that point in time, we'll all be better off, right? It's about connecting all the different pieces of the ecosystem together so that the platforms all speak to each other instead of having all of these silos.
So what do you think it's going to take to get there, right? Like you talked about the clarion moment of COVID sort of bringing everybody together for a common mission. And this idea of like radically transforming a healthcare system that the economic incentives are sort of adversely positioned against getting the outcomes that we want, right? Like cost is going up, outcomes are going backwards, like all the thing, we spend the most per GDP of any country in the world on healthcare. We're something like 23rd, 24th in outcomes.
Right.
So what from your perspective, sort of wrapping up the discussion, like, what do you think is going to be the thing that it's going to take for at least the U.S. healthcare system and all the players in it to adopt this kind of change? The example you mentioned around COVID, like that is a pressure point that forces everyone to pay attention. But there's got to be a better way to do it, right? From where you sit, what do you think that is?
I think it's courage. If I really was going to boil it down to like a one-word answer, it's courage. When we take a look at it and you looked at what happened during COVID, like, why are we backsliding from all of these telemedicine visits? People liked it. They thought it was easier. Well, it's because the reimbursement model that we currently have and the infrastructure that we have built out values the in-person visit more than it values what is the right visit for that point in time. If we were going to build a new healthcare system today, Bill, from scratch, right, it would be digital first. Everyone would have access to devices in their home. You would dial up a doctor or whatever the resource is. They would help triage you. And they would say, you know what, let's set up an appointment for you for next week. Or, hey, I'd really like you to come into the ER today, whatever it might be. It would be digital first. There's no doubt in my mind that that is the right front door for this healthcare system for lower to mid acuity cases, right? I mean, high acuity, yeah, you've got to be picked up by an ambulance, go to the ER and do all those different things. But while you're waiting for that ambulance, could not telemedicine help, or could the telemedicine actually help in the ambulance itself by bringing a specialist to the point of care for that paramedic who might need that support? And there are now business models that are coming up and new companies like Tele911 and others who are doing exactly that. So for me, it's about courage of someone maybe at the government level saying, look, the way we've been doing it isn't going to cut it in the future. It's time to build the next chapter of our healthcare system. Might it include, from a payer standpoint, the government going out? You ready for like my left field idea?
Sure, that'd be great.
Right. Why shouldn't the government go out and acquire Humana, Aetna, blank, 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 right? And set up what is a payer system that cuts billions of dollars of excess administration out of it, but they'd help coordinate care across those populations. And for me, it's just like, that's the way that things should be. We should have a system that has a base level of quality care. And right now there's just simply too many players, too much complexity, too many payers, right? All these different types of things. If you look at the successful healthcare systems around the country, they are simpler than ours is. So I think it's the courage to simplify and a little bit of conviction on our government and, with some of these entrepreneurs that are out there doing great things in healthcare to continue to build the new age of healthcare businesses.
Yeah, it's funny. What you're describing sounds a lot like the public option idea that has been floated around in Washington. And I always found it very, maybe ironic is the wrong word, that for political parties that value capitalism and competition, to basically not want to create a negotiating entity to compete in the market to drive down price seems like a huge miss, like on our part as a population and the leaders that are governing us. So I agree with you completely, though. Like, something has to disrupt it in the incentive model. And maybe that's the thing. They just need to marshal enough political will to get it done.
Yeah, I mean, look, if you're a patient in today's healthcare system and you need a procedure, right, there's a high likelihood that procedure throws you into bankruptcy. Healthcare is the number one cause of bankruptcy in our country. And what does that say about our healthcare system, right? Nothing good from that perspective. There are amazing pockets of great things that are happening in U.S. healthcare. There's a reason why people come to the U.S. for healthcare today.
Right.
But we could definitely help the lower end of the system raise its overall quality. And I think that's why we're starting to see a lot of innovation in people starting new Medicare and Medicaid plans, right? I think it's in Medicare Advantage plans, right? Like, people are seeing that there's a real opportunity there to create value, but I think we still need a little bit more conviction on behalf of our leaders to make it happen the way that we need it to.
Well, Jamey, thanks for taking some time to chat with us. For those of you that want to learn more about what Cloudbreak is doing, you can visit their website at cloudbreak.us. And be sure to follow Jamey on Twitter at Jamey Edwards. To learn more about how Komodo is reducing the burden of disease, please visit us at komodohealth.com. And follow us on LinkedIn and Twitter for updates for future episodes of For the Health of It. Thanks for watching, and see you next time. For those of us that want to learn, for those of us, follow us on Twitter and LinkedIn to get news, informations, and updates about our coming. Oh, I was so close.
I thought you were like right there.
I was right there. I was right at the finish line.
Our outtakes are going to be great.